Welcome back, karibu sana. We are back from the break and as we had said, we are coming back with Dr. Nakwambia wasichana si wamenipeleka mbio. Where I needed help. Anyway, we are back with Daktari. He's Dr. Steve from Clear Scan Medical Solution, Lydia Arcade Room 105 first floor. Hapo ndio pale tunapata scans as ladies. Na pia wanaume pia mnaweza pata scans pale. So, karibu sana daktari.
Thank you very much.
Yes. Hawa sana wamenisumbua sana. Hey. Paulette. Monicah.
Yes. So, our discussion was sex and contraceptives. And tuko hapa tuna debate. Right now the generation is being told that unapata actually their parents who are telling their children it's better to not get pregnant. So if you're having sex, they're actually teaching them how to use these contraceptives. And we're wondering, we've been told time and again that kuna side effects. So first, tunaweza anzia hapo kwa hizo, what are the side effects hizi vitu? Ziko na side effects, and if they do, what are the side effects?
That's a very broad question. Maswali pana sana. But I'll try to answer it in a nutshell as much as I can. When we talk about contraceptives, first it's important we know that there are different types of contraceptives.
Yeah.
There are what we call natural family planning methods. Let me use that common word. Contraceptive is it's a bit complicated for the general population. So basically contraceptives are family planning methods. And it's vizuri tujue kwamba there are different types. There are what we call natural family planning methods and all the traditional family planning methods, and then we have what we call modern family planning methods. So for the natural ones, you find that because they are natural, no side effects. Or if they are there, they are very minimal. Then we have the modern family planning methods, which are, of course, just like the modern medications, we have side effects. And what we usually apply when I talk about family planning methods, we talk about the benefits versus the risks. So you weigh the benefits and risks. I overheard your discussion about the risk. Is it safe to use the family planning methods, or is it just to go and have your pregnancy? The fact is, pregnancy itself is a risk. The risk of pregnancy vis-a-vis the risk of using contraceptive methods is higher compared to all the family planning methods. So you see, so the first thing is, you want to get yourself into that risk. Is it worth getting to that risk of getting pregnant? That's the first thing. So now, coming back to the family planning methods, I said there are natural ones. Natural ones includes the ones almost every other person knows, but unfortunately, they don't know how to do it right. In my interaction with my clients, I found out that utaambiwa hesabu siku, what you call the calendar method. That's one of the methods. That one does not have side effects because it's natural. So, but the problem now comes in, how do you even count the days? Because you'll find that the young people, and that's why they mess most of the time. I always talk to them and I get this point, and that's why I like talking about it every time I meet them. If you're reproductive age, the first question I'll ask you, and most of the clinicians will ask you, when was your last menstrual period? How does it flow? How many days? Is it painful? What is the cycle? Is it regular or irregular? Because now that forms the basis of if you can use the family planning method, that's a calendar method or not. Because if you have an irregular cycle, there is no way we are going to tell you to count the days. If you have a regular cycle, we will tell you you can use the calendar method. So now, most of the ladies I've interacted with, they think they are safe in between the cycle. But they are not safe when they are just about to get their menses. And that's when they mess.
Please tell us, Daktari. Continue.
There's something you've mentioned about irregular and regular. I think that's a very confusing thing. Yes. For a lady, when you go through her menses. Can you kindly explain the regular and irregular?
Thank you.
Because I think hapo ndio shida iko.
Yes, exactly. Every time I ask that question, what's the length of your cycle? Most people tell you 3 days, 4 days, 5 days. That is not the cycle. That's a flow. That's the duration of flow. So when somebody is asked about the regular cycle, regular and irregular, this is what every lady should know. You count the days from the first day of the floor to the last day, just before you get the next floor. You count those days, and you have to count them over time to establish if you have a regular or irregular cycle. So if you count your days from the first day of the floor to the next day just before, the last day just before you get the floor, and find, for example, your days are 28, you count the next month is 28, the next month is 28, then you have a regular cycle. If it's 24, 24, 24, 24, you have a regular cycle. If it's 26, 26, 26, 26, you have a regular cycle. But the others will find they have 28, 30, 26. That is now what we call irregular cycle. And that is what makes the difference between regular and irregular cycle. So for the calendar methods, remember I said it's for the people who have regular cycle. If you have a regular cycle, don't even bother.
Don't try.
Don't try. Yeah, because you might find yourself in a mess because you'll not be able to time the time of ovulation, which is very important in terms of when to get pregnant. So that is just one of the natural methods. There's another one that we should call body temperature checks. Again, that was a bit complicated, so most people don't usually. As we try to explain to people, they don't usually get to understand it. So it is not very much commonly used. That's why I've talked about the calendar method, which is very common among the young generation and even the other women who are of reproductive age.
Okay. And Daktari, to cut you off a little bit, I'm sorry to disappoint our viewers. This is not where we're teaching you these things and how you should do it. We're trying to discourage them.
Yeah.
So we want us to not explain them as much because we're trying to tell people that according to the Christian way, let us try to keep ourselves and maintain ourselves as God would want. Let us get cuffed. That is what we're saying.
Have fun.
Yeah.
But maybe it's good, unajua pia at the same time it's good to know because kuna watu wanakuanga tu na hizo mashida mingi. But again, now there's this question apart from that. There's this question in I get to kupata kwa young couples. Unapata mdema anasema ameingia into marriage and then hajapata watoi. Could it be using
Contraceptive?
Yes,
Contraceptive.
Yes. Maybe doc unaweza kutuambia mtu akitumia hizo before because they are really using it at their young age, they are really using it. Inaweza cause mtu kutopata mtoi ama inamfanya akae for a longer time bila kupata mtoi.
Yeah, it's as she rightly put it, and as she also put it, it has been a very delicate balance between do you talk about it in detail, do you talk about it briefly, or you don't talk about it. There is a truth on the ground. What you're saying, they're using it. Now, the modern ones, talking about the natural ones, they get no effects, no nothing. But now we have the modern family planning methods. They are different, but most of them. Now we talk about the barrier and we talk about the hormonal methods. The barrier methods have minimal effects. The hormonal ones, they have effects. And that's why now most of them, they're using them. And they're using them the way they're not supposed to use them. The truth is that when you use these hormonal methods, there is a possibility that there will be a delay in getting your fertility back. That is the truth, right? But again, it depends on an individual. It's not everybody who use them and they get the delay. There are people who use the hormonal methods, they stop them like today and next month.
They are pregnant. Yeah.
The others who take a majority of the hormonal methods talk about an average of 3 to 6 months. But it can take up to 2 years. The effects of that contraceptive.
Sana daktari, kuna haka kitu kanaitwa P2. Haka diko wanakibiriaga.
Ndo kanaongela
someone
made a joke squeeze wanazikunywa kama panado.
Wanazikunywa kama panado.
Wengine wanasema wanazikula kama jibu.
Ndio sasa. Yes. Hapo ndio kuna gashida.
Now that one is in fact if you were to compare which one is which, the long-term methods and the emergency pills, I will discourage completely the use of emergency pills. Let the emergency pills remain for the emergency.
Yeah.
For emergency.
They're called that
Only.
Emergency.
They are called
Only.
emergency for
They are
a
called
reason.
emergency.
Yes.
Yeah, this is for a reason why those are called emergency.
Yeah.
And some of the emergencies that are genuine are like somebody has been,
Raped.
God forbid, raped or
Yeah.
has been assaulted sexually. It's a young person. We don't want to expose them to that. That is an emergency.
Yeah.
Right? The problem with the e-pill or the emergency pills is that the amount of hormones that they contain is very high. That's why they're able to knock out.
Oh, mara hiyo
Right?
hiyo.
Yes. And the reason why we don't recommend them being used like the regular pills. I have come across that so many times, not only for the young generation, because we say this program is addressing every other person, not only for the young ones, even the mature ladies, they're also using it like a long-term method. It's not supposed to be used like a long-term method. It has its effects. And then now, because the hormones are too many, or the concentration of the hormones in these e-pills is too high, then now the effects are even more as compared to somebody who is using a long-term method, right? So we completely discourage. In fact, the risk, what is documented is that you're not supposed to use an e-pill more than 2 times in a year.
Na murasiri ya gukuta njugu.
I have a question about the pills. Kuna this thing sijui unaendaga unaambiwa uko na hormonal imbalance and then you're given contraceptives.
Yeah, you're given those pills.
And you're taking it like umemaliza
Like a dose.
umezimaliza then tuseme kama ni rashes course and all that and then unaenda kuconsult wanakwambia tena hormonal tena unapewa. Is that really safe?
Yeah, it's very safe.
Will it affect my...
Now, you see now, that's why I say when you look about contraceptives or family planning method, you individualize each patient or each client. You have come with special needs. I will talk about it and I will offer you the options depending on each and everyone, depending on their case. Like what you're talking about, we usually use these for patients who have what we call polycystic ovaries. Patients with polycystic ovarian disease, they tend to have hormonal imbalance and they will present most likely with acne. That those pimples on their face. And sometimes they look not very nice and want to look good.
Yeah.
If they're not intending to get pregnant tomorrow, and we know you can use them and control these hormones for the period of time that we are going to give. In fact, we should give 3 cycles, at least 3 cycles. By that time, the hormones have been controlled, the face starts to get better. It is the reasoning behind this is the way the hormones work, right? Because when you have like polycysts or you have polycystic ovarian disease, you have your ovaries having a lot of follicles, and when they are stimulated from the brain, then you get a lot of hormones now beyond the levels that you need. When you give you an exogenous hormone, we try to suppress the brain in order to produce the follicular stimulating hormone and the LH, so that the ovaries now are not stimulated to produce now the estrogen and progesterone. So it's like now you are trying to bring the hormones down. So over time, then they get controlled and then they get help. That's why I've said it is individualized. Not everybody who comes with hormonal imbalance will be given the contraceptives.
Yeah.
And again, it depends on their fertility needs. If somebody comes and they are, maybe you are married and you need this treatment, that's a question I'll ask you. When do you intend to get pregnant? Are you planning to get pregnant in the next few months or so? Then we discuss and we come up with a plan. So in this case, it has to be individualized. Huyu amekuja na hii, tunamshughulikia hivi. Huyu amekuja na hii, tunamshughulikia hivi. Not everybody who comes, uko na rashes.
Now have this.
Now on the fertility part, ndio watu wasipigane pale nyumbani. Unajua tumesema watu wanatumia pitu wanaweza kosa miba.
Yeah.
Unajua but there are those yenye ni natural. So si lazima tikue ni pitu ndio inafanya mtu asikue na mimba.
Yeah.
Exactly, like just what I mentioned, the polycystic ovarian disease. Okay, it brings about that because of the hormones. It is usually a bit difficult for that person to get pregnant. In fact, some of them we give them the hormones, we balance the hormones. The next thing, they get pregnant. Otherwise, as you say, we cannot generalize. Kila mtu anakuja kivyake. Na kuna wale naturally they have, like now that one I'm talking about, which makes it a bit difficult for them. Not that they can't get pregnant, because there are so many. I know there are people who are watching and they know they have gone to the hospital and they've been told you have polycystic ovarian disease. Yeah, there is a difficult. You compared to the rest of the population, there is some hardship in getting pregnant if you have polycystic. Yeah. So the moment you're given the drug, the hormones are controlled. They can get.
So usipige bid. Ati uanze kumuuliza alienda kutumia P2 wapi. Kuna there is the natural side, because even me it took me 2 years for me to get pregnant, you know, so it's pia inaweza kuwa hiyo the natural kupata mimba, so msipigane sababu ya P2.
Yeah, and again it's important for me to mention this, that when we talk about infertility, we talk about 100%. If you are not able to get pregnant, the lady contributes 40% of that problem, the guy contributes 40% of that problem, 20% just tunaachia mambo mengine. So again,
I think that is very, very important.
Yes,
because you find everything is blamed on the woman.
Lady, yeah.
Exactly. Ana unakuta a lady ndio anaambiwa aende akafanyiwe test.
Yeah.
Oh, wewe enda ufanywe, wewe ndio uko na shida. Wewe ndio uko na shida. Na labda unakuta hata ni mtu ni jamaa ndio ako na ka problem.
Yeah, men also have problems, reproductive issue problems. The only challenge with men is that they don't like there's health seeking behaviors.
Na ego, daktari usisahau.
Yeah.
I'm using a good
Kuna kaigo. Kuna kaigo. You know, here she talk, we say as it is.
And on that actually, men, maybe you can tell us a little about tunaongeleleanga family planning, and tunajua ni about women peke yake. Ni mwanamke ataenda apewe hizo madawa, aende ekwe sijui shindano and what. But is there anything that men can do?
Yeah, men can do a lot. Yeah. In fact, we encourage, even when we go to those family planning clinics, we encourage you come with your partner. Why? Because there are some things that might happen, there are some changes that might happen that you need. Your partner will need support.
Yeah.
The moral support is very important. And again, depending on an individual, there are ladies, for example, who cannot use hormonal methods. Right? They try to use the non-hormonal methods, they refuse.
Yeah.
The only thing that now they can use is the barrier method, right? The barrier method, most of the time, it's a man who is now in control. And you find that you tell them, this is your situation, you have this kind of a problem, you can't do this kind of family planning method. Then they're like, now what do I do? You talk to your man, tell them to use this barrier method. They come, yeah, wangu hawezi. So you see now, if they come together, they can help. And if they understand that there are some situation where now the lady cannot use, then it's better. That's why I'm saying that they play a very key role. And they can also play and help the ladies in family planning. Yes.
Wow.
And again, other than the barrier methods, of course, there's the sterilization. Sterilization is for men and for female too, what we call vasectomy.
Oh yeah.
Yes.
Where?
Hiyo ni kama tutanini.
I feel like we're in class.
Yeah,
again. Sijui ni biology ama reproduction. Can't say reproductive. Anyway, we have to go for a break for now.
Yeah.
But we'll still be back with our doctor. For more questions, the number 0721 899 899. Tuonane after the break.